good 1x2 exercise we can use for patellar tendinopathy would be a simple isometric quad set. What I'm going to have the patient do is press the back of her knee into the mat, raising her heel up off the ground. She can hold for 2 seconds at the top and then return to start. And she can perform this for 3 sets of 10. To progress this exercise, I can add a towel roll for feedback underneath her knee and ask her to press into the enlarged towel here, making it a 1x1. And then to progress this exercise, I can have her in short sitting on the edge of a mat and do a long arc quad, making this a 3x2. So a progressive exercise we can use when treating patellar tendinopathy would be simple fire hydrants, which is a 2x2. So standing here, I'm just going to ask her to bring her belly button into her spine to engage her core, and then lift this leg up off the table and out to the side, keeping her hips neutralized. We can have her perform this for 3 sets of 10. To regress this exercise, I can come in with a towel roll for feedback to help her make sure that she's keeping her pelvis and her core engaged. This would make it a 2x1. To progress this exercise, I can add a resisted TheraBand. Okay. Just placing it around her knees, again having her engage her core and her pelvis, and then asking her to go again. And this would make it a 2x4. To continue progressing your patient with patellar tendinopathy, we can do the 3x2 exercise of a long arc quad. So short sitting, we'll just have the patient extend her leg, hold isometrically for 2 seconds, and then release back down to start. She can perform 3 sets of 10 of these. To regress the exercise, I can add tactile feedback with my fingers onto the quadriceps muscle, asking her to contract, isometrically hold for 2 seconds, and then release back down. To progress this exercise, I can use a TheraBand around her ankle. In short sitting, we'll have the patient extend her quad concentrically, isometrically hold for 2 seconds, and then release back down for a count of 10. In an advanced stage of rehab for patellar tendinopathy, right before return to sport, you can start working on decline squats of 25 degrees. This is an example of a 4x2 exercise. In this position, we especially want to be targeting the quadriceps tendon eccentrically and not the glutes. So what we're going to have her do is perform a squat straight down with her back straight in line over her hips and her ankles. To perform this, we'll have her go down for a count of 10, hold at the bottom, and then come up for a count of 2. She can perform this for 3 sets of 10. To regress this exercise, I can provide tactile feedback to control upper body movement, or I can simply have her hold on to a table next to her. And to progress this exercise, we can add a weight, making sure that she maintains the straight upper body with her shoulders over her hips and over her ankles to target the quadriceps tendon. Okay. To continue progressing your patellar tendinopathy patients through the advanced stage of rehab, you can progress to a single leg decline squat. In this exercise, we still want to maintain our target over the quadriceps with an eccentric load through the tendon. To do this, she's going to maintain her shoulders over her hips and over her ankles. We are going to be wanting to watch for a valgus collapse of the knee because we do want her proximal hip to be engaged. The single leg decline squat is an example of a 4x2 exercise. To regress this exercise, we can add a TheraBand around the knee, encouraging her to push out during her squat to prevent valgus collapse. And to progress this exercise, we can add a weight. So home exercise we can perform for our patients with patellar tendinopathy would be lateral and posterior toe taps. During this exercise, we want to emphasize isometric control of the stance leg quadriceps tendon with upright posture, as well as posterior hip control of both the stance leg and the moving leg, lateral and posterior directions. Okay. To regress this exercise if needed, she can always stand next to a counter or table at home to provide some stability. To progress this exercise, we can also use a resistive TheraBand around her ankles. Another home exercise we can use in patients with patellar tendinopathy is a simple step up, which she can perform on her stairs at home. To perform this exercise, she'll just step up onto the stair on her involved leg for a count of 5. 1, 2, 3, 4, 5, and then lower back down. It's important to do the count of 5 so that we can target the eccentric control of this muscle. To regress this exercise, we can always have her hold onto her rail next to the staircase,